Spasticity is a common symptom of MS. Rhonda asked if there's research about the best type of exercise for chronic spasticity and if some types of exercise can make it worse.
Gosh, that is such a good question. I'm going to give you my best answer, but I'm going to hope that Christopher and Lisa have some suggestions too. So spasticity is a really big problem, right? So it's this inability to kind of relax your muscles, right? So they're tight, and if you try to move faster, they often get tighter. And it's very frustrating because everyone will tell me it's not like I'm trying to make it stiff. It's just this involuntary response, right? So I can tell you that historically, the best advice has been we need to maintain the flexibility within each joint. So for example, if it's my elbow that I feel really tight and it sort of stays bent a lot, then I want to make sure I'm stretching to extend the elbow. And when you stretch, you want to make it kind of this long, slow stretch, not a repetitions and not quickly. You want to kind of hold it for at least 20 or 30 seconds with each repetition. And I would do that, many times people will say their spasticity keeps them up at night, for example. And so I would recommend you can stretch before you go to bed and see if that can take away some of that tension that is causing your legs to feel the spasticity. I don't know of any evidence to say exercise can worsen spasticity, except that if you're exercising in this shortened range of motion that I was talking about, then that's not doing your spasticity any good, right? So you're strengthening, but in this shortened range, and that is, it will just encourage you to have what we call contractures, which is kind of a shortened or your joint kind of stays closed or shortened. The muscle stays shortened for a long period of time, so long that you can't extend it anymore. And that's what you want to avoid, right? Because, then you get skin breakdown and you get more pain. So my best advice as a therapist is really to do these long, slow, sustained stretches. There are casting options if it gets really, and there's also bracing options if that will help. And the idea with those two things is that, again, it provides this kind of very long sustained stretch. Some people will wear a boot to bed because it will keep their ankle stretched the whole time they're sleeping when they don't need to be using their ankle. So those are some suggestions I have, but I really would appreciate, Christopher or Lisa, if you have other suggestions, please let me know.
Thank you, Dr. Kathy. I will say that spasticity has been such a really difficult subject to kind of wrap our arms around. I will say the evidence is probably in its infant stage, if any evidence at all. But on personal experience, what I've seen with some of my patients, particularly at the Shepherd Center, is using water as a mode of therapy. Using the water, it's a little bit easier on your joints. It kind of changes the environment. You're not having to elicit as much energy to do movements as you would on ground. And then I've also seen a little bit of decrease in spasticity when I put patients on a vibration plate. Now, again, like I said, the evidence is either in its infant stage or just non-existent. But I would say what you would take from this is the best thing would be to add water into your exercise routine.
So excellent idea. And I think also drinking water would be helpful too in that respect. So I also want to add, I see that weather changes and some people feel that the heat can trigger fatigue, but sometimes it can trigger spasticity. But I actually see spasticity triggered more often by colder weather. So keep that in mind when the weather gets colder during the fall months, that spasticity may increase. So you might need to bundle up a little bit more, quite the opposite of what we're talking about with the Uthoff's phenomenon. Anecdotally, and I'm not sure if there's much research about this, but I've seen a lot of my patients when they have a full bladder, they tend to have increased lower extremity spasticity. So if you feel like your legs are really tight and you have to walk for a period of time, try to empty your bladder before you go. And then sometimes that helps the fluidity of the legs. And you guys might know the kinetics a little bit better, but I'm not quite sure what the correlation, but I do see that anecdotally for some of my patients. Range of motion, and then also talk with your providers about some medications that can help with the spasticity for just overall fluidity and improvements outside of the range of motion that they talked about.